Welcome back, everyone. Well, we are still very much in the middle of the COVID-19 pandemic, but we have also been in the middle of an opioid epidemic for more than a decade, and it has not let up even over this past year. There is still so much work to do to get people struggling with addiction the help they need, while also giving people who need pain management the care they need. So here with me now to talk about all of this, the DoNoHarm program, is Senior Associate Dean and the Director of Healthcare Policy and Innovation at OU College of Medicine, Dr. Stephen Crawford. Dr. Crawford, welcome to the show.
Good morning, everyone.
And first I want to ask you, we're talking about the DoNoHarm program here. So for people who may not know what that is, why don't you explain to us what DoNoHarm is?
Well, do no harm is a general term that we use in medicine as our ethos, as whenever we do something, we want to do no harm. But we came up with this particular name and a program to help primary care practices around Oklahoma do a better job at pain management.
And, you're going to be presenting some of your findings in your program at the Rx Drug Abuse and Heroin Summit next week. First of all, what is that summit all about? What are the goals there? And what will your presentation be focusing on?
Well, that particular conference is the largest national collaboration of people who are working on this particular issue. It's state, local, business leaders, academia that come together. It's included many presidents have made presentations there. Our Congressman Tom Cole will be making a presentation at this conference. But we were invited to present our Do No Harm project because it is somewhat unique in that what we do is what we take is evidence-based guidelines and help primary care practices in Oklahoma implement those. Now, most say, well, why don't primary care practices just do it on their own? Well, primary care practices are a very complex business, and they're very busy taking care of patients' daily health needs. And to try to implement new guidelines that have come out, which they did during the opioid epidemic, it was very difficult to do. So what we do is we provide both a clinician support to give them information, the evidence, and then we provide help for them in implementing those guidelines in a very complex system.
When we talk about pain management, that's kind of a broad term, right? Talk to me about some of the, what are some of the reasons that people would need pain management or help from a clinician? Just kind of talk to me about that scope of issues that people are facing.
Sure. Well, pain management is usually divided into both acute and chronic pain. Acute is where you break an arm or a leg or have a tooth extracted or have a surgery, and you need pain to recover from those events. And that is an area where sometimes problems have occurred in regards to giving a large amount of pain medications when only a little bit's really needed, and you have leftover medicine that unfortunately can go into the wrong hands. That's one aspect. But then you have another aspect with people dealing with chronic pain. Common problem throughout the United States, particularly as we age and we develop a variety of health issues, particularly like chronic back pain and such. And when people are suffering from that, they want to find relief. And there was a push back in the late 1980s, 1990s to think of pain and try to eliminate pain. It was called the fifth vital sign. And we were pushed as clinicians to really try to tackle that. We did, but unfortunately, we kind of went overboard and we're using opioids to an excess and causing a lot of health issues. This is a way to appropriately manage opioids, which are an effective pain medicine for certain very limited situations, but using them for chronic pain has a variety of health risks and problems that we want clinicians to be aware of.
So instead of prescribing these opioids for chronic pain, what are some of the other options out there besides just turning straight to the opiates?
Well, first of all, physical activity, trying to get people back to a program of physical activity, physical therapy, those types of things. We also look at biofeedback as a way of doing that and a variety of other non-pharmacologic means. Then you have a variety of non-opioid pharmacologic medications, including non-steroidal anti-inflammatory drugs, some medicines that are used to dampen the pain but without the opioid side effects, such as a drug like gabapentin is used very frequently for neuropathic pain, and many other medications that can be used to help that aren't an opiate.
And let's talk about opioids, though. I mean, is there ever a time where that's okay, where it is okay for them to be prescribed? Are they safe at all anymore, knowing what we know?
Well, I would say that opioids have always had risks, and there isn't a way to make them 100% safe, number one. Because opioids, and I would say any particular drug has some side effects, but opioids have a particular side effect that that's dangerous, and that's where it can stop respiration if given in a high dose quickly or higher than what the body is used to. And that's the real danger, and that's the overdose issue. And we've worked with our Department of Mental Health to help with this program, by the way. State Department of Mental Health has been a great partner with us on this. And one of the things that we actually advocate for is to, if a person's on opioids, say they've been on it for a long time and we're trying to help them reduce, that's an area that they can be put at risk of an accidental overdose. And we make sure that the doctors know about giving a drug called naloxone, which is an antidote to an opioid overdose for those patients. And our State Department of Mental Health have put what are called naloxone hubs all around the state to help patients get access to that in their families, so that if a patient does overdose on an opiate, they can be treated and hopefully a death prevented.
All right, where can people get more information on DoNoHarm and all the work that you guys are doing?
They can contact me at the OU College of Medicine, and they could also go through the Department of Mental Health, who we work with very closely. The Oklahoma State Department of Mental Health is another area of support.
All right, just such an important topic that we keep the conversation going. Dr. Crawford, thank you so much for this information, and we appreciate you coming on the show.
Thank you very much.
Jonathan, let's get over to you.